As I've said in the prayer that I was praying, this meeting is meant for the discipleship work in Botswana. We have discipleship work that is taking place there, and our intention is to be a blessing to the people of Botswana and to labor for revival to take place in Botswana. Now, it is the discipleship in Botswana which is hosting this summit, which focuses on healthcare, on the healthcare sector in Botswana. Let me explain also that we have not organized this meeting because there has been a change of government, and we have not been prompted by that. We usually plan our meetings the previous year. So the meetings we're running this year were planned in December of 2023. And we planned that at this time, we'll be having a summit for the Department of Health in Botswana. We thank God for the peaceful transition of government from the previous one to the present one. We prayed for the government when it was inaugurated, but the program itself is not prompted by that. It's the program that we planned a long time ago. Let me also explain that we're not only working in Botswana, we are focusing on the nations of Southern Africa, the SADC nations. That's why our brother in Tanzania is part of us. We're trusting that we will push the gospel in all the nations of Southern Africa, presenting Christ as the one who died on the cross for our salvation and for the need of the people to embrace Christ by faith and experience a new creation in them. I wanted to explain that. Now, when we are organizing a meeting, we often pray that God would reveal to us what is on his heart or what is on his mind for the meeting. We don't want to hold a meeting for God and impose on God what he wants to say, what should happen, but rather we want him to tell us. So the theme then, I'm going to dictate it to you, and IT will be helping us. The theme is the healthcare workers standing between the living and the dead. That's the theme. Healthcare workers standing between the living and the dead. It is taken from number 16. It talks about a situation that took place there. People who argued that they also were leaders, just as Moses was a leader, Moses and Aaron. So they elevated themselves to the position of Aaron and Moses. And God was displeased with their arrogance. So number 16, verses 47 to 50 reads as follows. So Aaron did as Moses said, and he ran into the midst of the assembly. The plague had already started among the people, but Aaron offered the incense and made atonement for them. He stood between the living and the dead, and the plague stopped. But 14,700 people died from the plague, in addition to those who had died because of Korah. Then Aaron returned to Moses at the entrance to the tent of meeting, for the plague had stopped. You have noticed that verse 48 says, he stood between the living and the dead, and the plague stopped. That is Numbers 16 and verse 48. Just to mention that those in the healthcare profession, particularly doctors and nurses, they literally stand between the living and the dead. They welcome those who've just been born. They nurse them to life. They enjoy seeing them growing and living. But at the same time, they deal with people who are at the verge of dying. And some die in their hands after having tried, sometimes in vain, to stop these people from dying. So they are then laboring between people who are living and people who are dying. Sometimes, unfortunately, on some days, the dying are more than the living. But on other days in their wards, the living are more than the dying. So their ministry is precarious in that they welcome the newly born, they assist those who are living, they do what they can to prolong their lives on earth. But at the same time, they minister to people who are terminally ill, who are deathly ill, and some of them, unfortunately, actually do die. Just like Aaron ministered between the living and the dead, nurses and doctors and others in that profession also minister between the living and the dead. Now we have a caption which appears in the flyers in the poster that we sent to you. And the caption reads, "Praying for the health of the nation and mobilizing the saints." So we're doing two things in this summit tonight and tomorrow. We are praying for the nation of Botswana, particularly the Department of Health, and we are mobilizing those in the sector to render good services in that sector, particularly those who are born again, those who are the saints. We are mobilizing them. Those are the two things we will be doing. Sorry, let me drink water. Those are the two things we will be doing. We will begin then with some instructions, and then we will close today and tomorrow. We'll have a set of prayer items for tonight, and we'll also have a set of prayer items tomorrow. If the Lord helps us, we will not force anything. We will go steadily. We want to deal with 3 points if we are able to. If we are not, because we have tomorrow, we will do that tomorrow. The first thing that we want, first point, is reasons why the health department of any nation is the most important. That's the first point. The reasons why the health department of any nation is the most important. We'll advance reasons why the Department of Health is very critical, very important. Then point number 2, what is needed for the health department of any nation to be the best? What is it that is needed for the health department of Botswana in this instance to be the best department? Will be point number 2, if the Lord allows us to advance to that point. And then point number 3 will be, what is the role of healthcare workers in improving health standards in any nation? What is the role of those who work in the Department of Health in improving health standards in their nation? That will be point number 3, if the Lord helps us to deal with these points very quickly. And then tomorrow, we will be focusing on the Bible. Tomorrow, we'll deal with the fact that human beings were created to not to be sick and die. They were not created to be sick and die. We'll explain that briefly, that it was never God's intention in the beginning to create people who would fall sick and die. So sickness and death are not part of God's plan for his people. It was never. Then the second point we'll deal with, I want us to enumerate these points so that when we begin to deal with them, you will know where we're going. Maybe you're writing these points down. You have an idea of what direction we are taking. Then the second point tomorrow will be sin introduced sickness and death. It is sin that introduced sickness and death. Before the advent of sin on earth, there was no sickness and there was no death. It was sickness and death, and ill health was precipitated by sin. That is point number 5, with which we'll deal with it tomorrow. Then point number 6 will be Christ came to restore health, good health. We'll explain how we did it. The Bible says, by his stripes we are healed. So he came to purchase our health on the cross. And then if the Lord helps us, we'll deal with 2 other points tomorrow. Let's just delve then on this and see how far God will help us. Now, some of the points that we'll be dealing with are points that would need elaboration. But since we're not conducting a workshop, we don't have time for elaboration. We'll mention them, and some of these points are familiar to those who are in the healthcare center. Let's deal with point number 1 then quickly. Reasons why the health department is the most important. It is true that it is the most important. We are not saying that education is not important. We're not saying the judiciary is not important. We're not saying that the Department of Finance is not important. They are all important. But the Department of Health, in my opinion, is that it is the most important. Let me quickly delineate some reasons why I say so, and I'll be short. Reason number 1 is that when the nation is not healthy, the nation will also be not wealthy. In other words, a sick nation results in a sick economy, a sick Department of Education. It affects all other sectors when the people are sick. We know this when there was pandemic. We knew the importance of health because it closed all other departments. They came to a standstill because there was no health. Nothing could move. Other departments, all other departments were forced to close because nations were suffering from the problem of lack of health. When the healthcare center, when the healthcare center is not well, nothing is well. That must be clear. That must be very, very clear. That is the first reason. That is the first important reason. So the health of the nation, let me put it this way, the health of the Department of Health contributes to the health of all other departments. That's important. Those who work in the Department of Health, they actually bring health on earth. They bring life on earth. And then they ensure that the life they bring to this world survives. It is the Department of Health that receives every person who is born into this world. When they are born, they are fragile. They are fragile. And when they are born, they are shocked by what they encounter on this world. And it is people in that department that makes sure that all the people who are brought into this world through their hands survive the harsh reality of the world they are coming into. That's very important. So that's why then they make sure that the birth rate is high and the infant mortality is low. That's a very important responsibility they have to the nation. That's point number two. That's point number two. Point number three, as the theme of our conference states, the people who work in the Department of Health are laboring in between those who are living and those who are dying. They are working very hard that those who are living will continue to live, and that those who are dying, they will try to stop death taking their lives. If they were not to be successful in their work, the living would die, and the dying would also die. And then the nation would be in trouble. Their work is extremely, extremely important. Point number four, it is those in the Department of Health who protect human life. They protect human life. They ensure citizens' health and well-being and survival. It is their responsibility that citizens are healthy, citizens are well, and citizens are surviving. It is in their hands. That is their duty. During the pandemic, that was accentuated. We could see it. They were working very, very hard. Even though they themselves were exposed to this pandemic, they could not run away and hide in a corner. They had to execute their noble duty to ensure citizens' health. They protect human life. Number five, those who work in the Department of Health, they contribute to economic growth. It's important for us to know that. When there's a pandemic and the people are not healthy, the finances, the economy of the nation also becomes sick. Countries are recovering from the pandemic that took place in 2020, COVID-19. Because there was that sickness, the economy also suffered the consequences of that lack of health. So those in the department are indispensable, actually, to the economy of the nation. A healthy workforce increases productivity. A healthy workforce increases productivity. It reduces absenteeism. When people are healthy, unless they are lazy, they are not absent. But when people are very sick, there's a pandemic that is attacking the nation, it contributes to high absenteeism, which adversely affects economic growth. Number six, those who work in the Department of Health increase national security. National security. A strong health system prepares for and responds to emergencies. Because emergencies are bound to happen. If, for an example, there's a mine that has collapsed and many people are injured, ambulances drive to healthcare centers for these people to deal with emergencies. Where there are trains that are running in the country, if there is a collision between two trains and scores of people are injured, where do they take these people to? They take them to hospitals, to centers where health is offered. Now, if these centers are not prepared for emergencies, they are not able to respond to emergencies. Emergencies such as pandemics, the collapse of mines, big accidents on the roads, buses carrying many people colliding, or what we call bioterrorism. Then if that nation is not prepared for emergencies, has no capacity to respond, the nation is not secure. That's why we say they contribute to national security. Number 7, they also contribute to social stability. Social stability. Accessible healthcare reduces inequality, it reduces poverty, and it reduces social unrest. For an example, in my country, the country of South Africa, maybe you're reading about it, we're facing the scourge of children in townships and in squatter camps, places occupied by poor people, buying food from what we call spaza shops here. They're getting sick. Now people now are agitating about it. The government does not seem to have been ready for this. Now they are struggling to contain the problem, and they don't have enough healthcare inspectors. They don't have enough health inspectors. And now the people say, why don't they have enough health inspectors? And our children are dying. Is it because they don't care for our children? Do you see now how social unrest can be precipitated by a health disaster when the sector of health is not able to handle the unforeseen, the unexpected? There could be a social unrest. So they forestall that. When the health department is well organized, systems are ready to face any eventuality, any occurrence, such that the occurrence is nipped in the bud, as it were. When that does not happen, social unrest is threatening. Number 8, those in the healthcare sector contribute to human capital development. A nation needs human capital. It also needs financial capital. And financial capital cannot take place if there is no human capital. So the Department of Health invests in citizens' potential. Those are young people, make sure that they are strong. They are sharp mentally. They are sharp physically. They are sharp emotionally to contribute to the nation. It is the capital that the nation needs in order to build itself. It is this department that fosters education, it fosters innovation, and it fosters national progress. It is the Department of Health. It's a very important department. It really is. Sometimes it surprises me when governments allocate less money to this department. It's short-sightedness for them to do that. They ought to pump in a lot of money to this department because it is pivotal to the progress of the nation. Number 9, those who work in the Department of Health, they promote what we call global interdependence. Global interdependence. A good health system collaborates internationally to address global health concerns like pandemics, disease outbreak. They collaborate. When there was COVID-19, there were scientists from South Africa in the Department of Health who collaborated with World Health Organization and other organizations. There were brilliant scientists in Botswana. I think one of them came from Zimbabwe, but he was operating in Botswana, and it was reported that this scientist was doing a good job. There was collaboration. And I'm sure the nation of Botswana was happy when their own national was quoted in newspapers as making a significant scientific contribution globally in fighting COVID-19. So it is people in this department who promote global interdependence. For an example, who takes people from our nations? The man right now who leads that World Health Organization is from Ethiopia. He's contributing there. And there are people from other countries who have contributed, who have, shall I say, donated their nationals to partake in that big body. Number 10, they drive research and innovation. People in the health department drive research. There are people who are researching on cancer, researching on HIV and AIDS, researching on diseases that have to do with the heart For an example, they are conducting research. I'm going to explain later that any country that wants to do well must contribute to research in their nation, research laboratories, and scientists who are engaging in research. A good health system drives medical advancement. It improves healthcare outcomes and equality of life. So they drive research and innovation. Number 11, they prevent epidemics. It is scientists who will announce in advance that there's a threat of a certain epidemic which is rearing its ugly head. They are the ones who anticipate these things. And once they announce that a certain epidemic is going to come, then it alerts people in the health department to prepare for it. So they want to prevent, if they can, epidemics. So a good health system will detect an imminent epidemic and then respond, if they can, to prevent it. Number 12, they support vulnerable populations, particularly the poor. The poor are vulnerable because they don't have good nutrition and because they are malnourished, and opportunistic diseases affect them, infect them, and affect them. So they support such people. They've got programs that is focused on vulnerable populations. For an example, services to the poor, services to the elderly, services to children, and services to marginalized communities. So they have to have programs that focus on those. Because if you don't arrest epidemics amongst those who are vulnerable, it will not end there. They'll be affected, but they will transport that epidemic to those who are affluent, because they're working in their homes. They may be carrying the disease and bring it to the homes of the affluent. So that's why they must focus on the vulnerable. Number 13, those in the health sector enhance national reputation. National reputation. I've alluded to the scientists who were from Botswana, and when they were quoted at Harvard, quoted in other big institutions in the developed world, Botswana was being put on a map. They were being recognized. And those who did not know where Botswana was, they Googled it. They knew where Botswana is because of the renowned scientists who worked in Botswana. Is the contribution of those in the health care sector. So all these reasons show the importance of the Department of Health. Any government that does not put in a lot of resources to this department, they are short-sighted. Truly they are. They don't realize that the whole nation will be adversely affected by their negligence to put money there. The health department, the functions of an effective health department is disease prevention and control. If it is effective, it will prevent diseases and control them. It will be health promotion and education. It is healthcare access and quality assurance. It is emergency preparedness and response. It is research and innovation. It is policy development and regulation. It is healthcare workforce development. That workforce must be constantly developed. And it is community outreach and engagement. These are the duties of an effective health department. I'm trusting you've seen the importance. I wish even those who are not in this department could have been part of this summit to realize the importance of this department. Let's go to the second point. I will not try to be elaborate in dealing with it. What is needed for the health department of a nation to be the best? Because we're alluding to the fact that the Department of Health must be the best. It must be the best. Now the question then is, what is it that is needed from this department to be the best? Number one is leadership and governance. Nothing can really thrive without good leadership. The rising and the falling of any department depends on the leadership. Sometimes those in the health department, they tend to be scientists who are not well equipped when it comes to leadership. You don't lead effectively because you have got a degree or degrees in medicine. No. You have to hone your leadership skills, and your leadership is seen in the thriving of the Department of Health. When the Department of Health is doing well, is growing, it speaks to the effectiveness of leadership and also how the department is governed, the governance of the department. That's important. When the leadership and the governance are good, chances are that the department will be the best. Number two, what is needed is infrastructure and a resource. That's important. The department must have good infrastructure. It must have modern facilities and equipment. It must have adequate funding and budget allocation. It must have well-maintained supply chain and logistics. So the issue of infrastructure is important, and the resources are needed. And the machinery in the Department of Health are very expensive. And usually they are not ordered in our own nation. Our brothers in the West, they monopolize this. They are the ones who are manufacturing them. And we must order them from Germany and from other countries. And for them to be transported to our nations is costly. And therefore, resources are necessary if the Department of Health will be effective. Then service delivery is important also. There must be comprehensive healthcare services. I said comprehensive. Comprehensive healthcare services. There must be accessible, equitable, and affordable care. And people who live in squalor conditions, in our case, we live in townships, who live in shacks somewhere. It's not easy for them to access healthcare. First of all, it is not even affordable for them. So a good department, if it wants to be the best, must look into that. And they must have patients-centered care. It must not be doctor-centered. It must not be nurses-centered. Rather, it must be patients-centered. Because patients are the clients, and therefore it must be centered on the clients that we service in the department. Number 4, it must have human resources, competent, motivated healthcare professionals, not lethargic healthcare professionals, indifferent healthcare professionals. They must be competent. They must be enthusiastic, motivated in the work they do. Human resources are important. Effective workforce planning and management. Effective workforce planning and management is necessary. The staff wellness and the prevention of burnout. Because when people are understaffed and they are working overtime, for many days their sharpness is blunted and they are no longer as sharp as they could be. They suffer from what is known as burnout. Then what else is needed is technology and innovation. That's needed. telemedicine, digital healthcare services are needed. Data analytics and research capabilities, all those things are needed. Number 6, partnership and collaboration. If the Department of Health is going to be strong, it must collaborate with people in other sectors. It's called intersectoral collaboration. They collaborate with those in education, with those in other fields. There must be collaboration. That intersectoral collaboration is important. Those in the social services, for an example. Partnerships and collaboration is important. Then number 7 is the issue of quality and safety. Quality and safety. So the issue of accreditation and certification programs is important. To be running all kinds of programs to improve the quality of those who are rendering services. They should offer scholarships to those who have who qualify for scholarships to go and study elsewhere. They should have also study leaves. When people want to advance themselves, if, for an example, they are staff nurses, they want to become professional nurses, and there's an institution that does that, then they must be given a leave of absence and be paid while they are studying, and be a requirement that once they finish, they must come and serve the department for the number of years they've been studying. People would be willing to do that because it means they're empowered, they're given more skills. Then there must be emergency preparation. The departments must anticipate emergencies, and it must be prepared to respond. They must have plans in place in order to respond when an emergency takes place. Then number 9, the issue of community engagement. My wife is a nurse, and she was teaching in the department of community nursing. People were taught how to deal with community issues. That's important. That community engagement, there should be no cleavage between healthcare givers and the community. So the issue of public health education becomes important. The issue of community outreaches, doctors spending a day in a month at least for a community outreach. That's important. Issue of health promotion and prevention programs. All those deal with community engagement. So those are the things that those in the Department of Health must engage in to ensure that they've got an effective and competent Department of Health. Now, the next point that we want to deal with is the role of healthcare workers in improving health standards. The role of healthcare workers in improving health standards. That's important, extremely important. What is their role in doing that? I'll mention a few. First one, direct patient care. Direct patient care. I would suggest personally that even those who work in the offices, there must be a time when they visit wards, just to have a feel of what is happening, visit clinics. They must not be reading this from reports which is submitted to them on paper, and they have no idea of what is happening. Some of them, they had direct patient care. Then they were promoted to the high positions they occupy. Now they forget what is happening in wards where patients are. They are outdated. They don't realize the current issues with which people who deal directly with patients are facing. So that's important, that direct patient care for everybody. That's important. Then those who are actually working then, who are having this contact with patients, they must provide preventative care, like vaccinations, screening, and so forth. They must manage chronic conditions. They must deliver emergency care. They must educate patients themselves on healthy habits. That's direct patient care. Then number two, there's the issue of health promotion and education. This is where community outreaches and health education becomes important, because they're promoting health and education. That's important. Then number three, what they need to do in order to contribute to the health of the Department of Health, to improve health standards. These are the things they need to do to improve health standards. Those who are in the department themselves. Number three is the issue of quality improvement and safety. They must have programs that are improving the quality of health care they give. That's very important. Monitor and report adverse events, develop and enforce infections control protocols, ensure patient safety and satisfaction. There are things they can do, a range of things they can do to improve quality. So they are talking about it in the departments, but sometimes we talk about things which we don't implement, and talking about them does not help much. Then there's the issue of research and innovation. That's so important, that there must be people dedicated to research. It must not only those who are research scientists, but nurses themselves must sometimes given time to go and research certain things and give reports. And doctors who are overworked in some of our hospitals, they don't even have time to read journals, medical journals. They must be given time to research. That will improve the department. It really will. It will. They will become exposed to newer ways of giving medical services. Then number 5, the issue of policy development and advocacy. There must be policies that are geared towards development in the department, making, advocacy for certain things that are needed. That's important. For an example, advocate for healthcare access and equality, to advocate for collaboration with government agencies, advocate for it, and so forth. Number 6, community engagement and partnerships. The Department of Health must engage in community engagements and partnerships. Partner with community organizations, the NGOs that are working in the field of healthcare. Those are working, dealing with psychological problems and issues of depression and so forth. Collaborate with them. Yeah, that's important. Provide cultural competency training. Foster interdisciplinary collaboration. Interdisciplinary collaboration becomes important. Then the issue of leadership and mentorship. There should be a lot of mentorship that takes place. Some nurses were nurses some years back. In those years, nursing was a very respectable profession, and they were very competent in executing their duties. And then those who have those skills must be given an opportunity to speak with the new nurses, to share with them how they used to exercise nursing, for an example. There could be benefit in that mentorship programs. Older doctors mentoring younger doctors. That's important. If we run that program, it could be a big contribution to the Department of Health. Students being mentored, junior staff being mentored, that could improve. And then healthcare workers are essential. They can contribute to the improvement of the department. They can improve health outcomes. They can reduce morbidity and mortality. They can enhance quality of life. They can promote health equity. They can advance health goals. All these things are necessary. Sometimes they are so overworked that they are understaffed and overworked, and they can't even think of these issues because they are dealing with pressing matters that they don't have time to be thinking about these issues. Let me take one last point for tonight, and then we'll take others tomorrow. And then for now, we will be praying for the health services of Botswana. The point I want to take now, and I'll be brief on it, is that human beings were not sick. They were not meant to be sick and to die when they were created. When we read the Bible, we get a clear impression that God wanted human beings to live like angels. We never hear that there was a funeral of an angel and other angels were said to bury their colleague. Angels live forever. Now, there are two spheres in which God operates. He operates in the heavenly sphere, and the servants that are used there are angels. And he operates on the earthly sphere, and the people who operate here are human beings. Now, the plan of God then was that angels would live forever, they wouldn't die, and that human beings on earth would live forever and they wouldn't die. So what God did, he gave them bodies that were robust. He gave them souls. A soul is the seat of emotions, in intellect and will. Those are situated in the soul. Emotions, intellect, and will. That part was strong. Strong minds, strong emotions, and strong will. Of course, that strong spirits. They're strong spirits. They were created to live forever. Forever. That's important for us to note, that health is valued in heaven. That's why when you read in the book of Revelation, the Bible speaks of the New Jerusalem. It says people will not be hungry, people will not be sick, and people will not die. What they were created to be will be realized in the future. Now, what God did then, in order for them to be healthy and to live forever, he created them in his image. God does not die. God never gets sick. So God imparted into them the life of God. They were carrying the life of God in them. Genesis 2, verse 7, God created the body out of the dust of the earth. Then he breathed into their nostrils the breath of life, and then they became living beings. So God imparted himself, and God who never dies, God who never gets sick, now imparted that quality of life in them. So they were carrying the life of God, which is not susceptible to illnesses and death. We read this in Genesis 1, verses 26 and 27, and it reads as follows: "Let us make man in our image, in our likeness, and let them rule over the fish of the sea and the bird, over the fish of the sea, and the birds of the air, over the livestock, over all life, and over all the creatures that move along the ground. So God created man in his own image. In the image of God, he created him, male and female, he created them. So God put his own life, which is not susceptible to death or to illness, into this body of this man. So he has a never dying life. A life that never gets sick is put into them. Now, what is important is to note the kind of life God breathed in him. It was the life of God. Job 33 and verse 4 says, "The Spirit of God has made me. The breath of the Almighty gives me life." Do you see the correlation between the Spirit of God and the breath of the Almighty? The Bible says he breathed into human beings his life. Now, this verse tells us that this which God breathed into their lives was the Spirit of the Almighty. And the Spirit, there is capital S, the Spirit of the Almighty. So we were carrying the Spirit of the Almighty, who never dies, who never gets sick. Now, what is important to note, please note this very carefully. God meant human beings all over the world to be healthy. Global health. He meant people everywhere in the world, globally. They should be well. Right now, as we speak, there's a difference. People in the West are relatively well, and people in the South are sick and ill. And people in the West don't even want to share their medicines with people in the South. The idea that all of us must be well is not clear, and yet God wanted people globally. People in Japan, people in China, people in India, people in Latin America, all over the world, in Lagos, in Nigeria, wanted them, all of us, to be well. We get this in Genesis 1 and verse 28. It says, God blessed them and said to them, "Be fruitful and increase in number. Fill the earth and subdue it. Rule over the fish of the sea and the birds of the air, and over every living creature that moves on the ground." Now, the point I want to get here, that Adam and Eve was carrying the image of God. Now, God tells them that they must bear children and transfer the image of God which was in them to their children, so that they too will have a life that is never dying, a life that is never sick, the image of God. When you read this in the Good News Bible, it says, starting from verse 27 in the Good News Bible, it says, "So God created human beings making them to be like himself, making them to be like himself. Oh, if God does not get sick, they were not going to fall sick. If God never dies, they wouldn't die because they would be like him. He created them, male and female. He blessed them and said, have many children. Have many children after your own kind, so that your descendants will live all over the world, will live all over the earth. Your descendants will live all over the earth and bring it under their control. I'm putting you in charge of the fish, the birds, and all the wild animals. Point I'm harping on is that God wanted people all over the world to be healthy. And this was contingent on them bearing the image of God. Now, people then in the past lived for many, many years, even after sin had entered. Talk about that tomorrow, that sicknesses were introduced by sin. When human beings fell into sin, that's when they began to fall sick and to die. But even after sin had entered in Genesis chapter 3, because people are not as wicked as people are in later generations, people continued to degenerate, and they were becoming worse from generation to generation. But the earlier generation lived for many years. Let me just show you the numbers. Methuselah lived to be 969 years. He was left only with 31 years to reach 1,000 years. Was close to 1,000 years. Jared lived for 962 years. 962. Noah lived for 950 years. 950. Adam lived for 930. 930. Seth lived for 912 years. 912. Canaan lived for 910. 910. Enosh lives for 905 years. So there were 7 people mentioned in the Bible, and I assume there may have been others who were not mentioned in the Bible because there was no need for them to be mentioned, but 7 people lived above 900 years. 900 years. It shows the quality of body they had, the quality of mind, the quality of emotions, quality of will. It was an out of the ordinary kind of life they lived. It shows that they were never meant to die. I'll never mention those who lived below 900 years. It shows that we were meant to live actually forever. Actually. We're meant to live forever. Then sin entered into the world and it spoiled the whole situation. And we'll talk about that tomorrow. Maybe before I raise prayer points, are there any questions? And then we'll be raising prayer points. IT will monitor people who are raising hands either to ask questions or to make comments. Maybe let's stop the recording and then start with questions and answers if there are any.